Hey, Dr. Shakib here from Irvine Spine and Wellness Center, your Irvine Chiropractic Posture and Wellness Clinic. I'm here with my lovely Lavanya, who came here with an issue in her shoulder, and this video is going to basically show you a take from the patient's perspective as to what it is we do and why what we do is so different. So stay tuned. All right, so let's talk to Lavanya about your experience. Lavanya, what brought you here?
So a couple of months ago, sometime last year, I had issues with my shoulder. I couldn't, move my arms, and I couldn't wash my dishes. So pretty much my day-to-day, activities were very limited. So that's the reason why I'm here. I thought about going to physiotherapy or to a regular doctor, but then I got an advice from a friend to just maybe try out a chiropractor, and I Googled you and I thought I'd try it out.
Right, I remember I asked you who referred you here, and you said Google, and you read the reviews, and all the reviews
and it was close to work, and that was important to me because that way I could come in during my lunch hour and get my treatment done, whatever is needed.
Very good. Just for the record, Lavanya's diagnosis would have been frozen shoulder. Now, do you remember when you first came in? When I examined you, how did that? Did you have any limitations other than what you mentioned with chores at home? Did it impact your work performance?
Yeah, so I noticed that it was kind of gradual. So first I thought, okay, it's just like regular pain, and I thought I can work it out. I was doing some basic exercises, but that didn't help. I got even massages, that didn't help. And then when I started realizing I couldn't sleep like normally, I couldn't roll on my right side, right? And I like to sleep on my side. I couldn't do that anymore, and washing dishes, and that's when I knew that there was something else going on which I cannot fix,
So now I remember when you came in, I never forget the very first treatment we had, which we'll get into more. But one of the first things that I noticed was I call it muscle thumping. So I remember you were actually sitting right here, and I had you do some very basic, move your shoulder blade in the back, kind of positioning the joint not the way it should be. And you did a couple moves, and then your muscles were shaking so bad, and it was so tired.
Yes.
So positioning the joint where it needed to be was actually a task. And do you remember the neck issues? Why don't you mention the neck issues that you were having, which I'm sure you thought, well, that doesn't have anything to do with my shoulder.
Yeah, so I have had chronic neck issues, and I thought it's because I sit on, in front of the computer all day, and I just thought, massages would make it go away, but it didn't. So I've had chronic issues, almost many years, I would say, I don't know, maybe 10 years or so.
Yeah.
But I never thought it was related to the shoulder issue, to be honest.
Yeah, I totally understand now. Was there, were you hesitant to come here? Did you have were you scared of anything? So prior to seeing me, and then of course you fell down.
Well, to be honest, I was very skeptical. But then I said, what the heck? I'm not going to lose anything trying. So, and I don't want to do surgery, or I didn't have a good feeling about physiotherapy. So I said, let's try, a chiropractor.
Just because your friend had mentioned this.
Yeah. So I came here, and then I was skeptical. Then you had me get an X-ray done. And then as I started going through the treatments, the treatments were not, I wouldn't say it was like painless.
The cleanup process.
The cleanup
We're
process.
talking about the functional rehab, which is movement of the joints and muscles and bones by very specific muscles. So every muscle has their primary task and secondary, tertiary tasks, etc. So basically making sure that the right muscle was making the right move. And so with a lot of restrictions in movements, chronic issues, we have quite a bit of stickiness with the joints, so it's loosening those up, which is not massage, it's movement while we're targeting the muscle fibers.
And I remember the first time you checked me out and you said, what have you done to yourself, because it was like you could tell.
Yeah.
And I had no idea what was going on, and then you said, this is really urgent, you need to treat it right away, otherwise it can just freeze,
Yeah, because you had some limitation. I think the worst case I've seen was when patient had maybe a few inches of mobility in that area, and you had at least some of that.
Yeah.
Now I'm just tell us about your friend. Now your friend was, when you told your friend about how different your treatment here was, because this is a chiropractic office, but I do postural neurology and functional movement. So did you ever explain what was happening here treatment-wise to your friend?
Yes, my friend suggested that I go check out a chiropractor, and my initial thought was, okay, the chiropractor would just do back adjustment. When you have a problem, you go and fix. And so when I told my friend, well, that's not it. I mean, Dr. Shakib is not just doing adjustments, but also going through this whole treatment process and a cleaning, and my appointments were like at least 30-40 minutes, right?
Yeah.
I mean, the first few cleaning appointments. Yeah. So I thought that is what is like makes you apart from any other regular chiropractor.
Yeah.
And that's really key to why I am here, and how my treatment was so successful. So,
well, I'm so glad. So one of the things that we do that's different is the functional movement exercises, or specifically it's called DNS, or dynamic neuromuscular stabilization, what the babies typically do to achieve movement combined with postural neurology. Now, why don't you share with everyone what we did typically? Did it involve any weights? How is it different? Was it anything like physical therapy, by the way?
To be honest, I haven't been through physical therapy.
But do you have any understanding of what happens in a physical therapy office? Is with bands and weights and everything else?
Yeah. So it was not like that.
We did not use any of that.
Yeah.
So did we target just the shoulder joint, or was it more?
So my treatment was a combination of both the cleaning and teaching me exercises, and it was not just the shoulder. It was like all the, I think you call it the feeders.
Yes.
Feeders to the, I remember something. So you pretty much make sure that the feeders are working well, and you also explained to me how this arm was overcompensating, which is making this, so it was kind of like a joint. It's all related. And then it was interesting, like how after a couple of adjustments, you were adjusting the neck, but my shoulder started. I was getting more mobility on my shoulder.
Yes.
So I mean, it was very different.
Now, one of the things that I want to clarify here is the type of exercises that we do. It wasn't like, it wasn't in isolation. We didn't isolate your shoulder joint and give you exercises for the shoulder joints. We put you in different poses that would require every muscle to perform their primary task as you were going through the movement. And that's the key. Our issues are not in isolation. Our issues come in movement. So how long after, I wonder if I should share with everyone what you said to me. I hope I don't embarrass you.
I may not remember, but yeah, you can try.
So we were talking, and I said, what's your goal? What is it that you think you'd like to achieve? And she said, I'd like to be able to put my bra on.
And now I can.
Now you can. Why don't you turn around and show?
So I can go all the way back.
So this is, and I can't take credit in any of this. What I'd like to make sure that you're aware of is knowledge I have and what I know is only effective if the patient is eager to get there and is involved as a part of the team. Now, with our team, we got down onto the floor, we did exercises together, we analyzed and dissected. And the reason for that was because I don't want to see a patient for the rest of their life. I want to empower them with understanding of how to analyze their lacks in performance and actually see it. And I know that you have.
Yes.
You have mentioned that, and I have seen you perform. So that cortical connection where and your proprioception, knowing where every joint needs to be in space, is now automatically coming to you because you've repeatedly performed it.
Right.
And you recognize when it's not.
Yeah,
I mean,
little things like you make me be aware of my scapula, like say, okay, just move this. I mean, little things which I would have never even thought about,
right.
And how it all like feeds into the healing process. So it was amazing.
And one thing that I'm talking about scapula is that I remember I said, can you move your shoulder blade in that direction? And you went this way.
Yeah, I didn't even know what that meant.
Which is the pathological patterns of
Yeah.
movement when you get something done but not using the primary muscle. So it took a while for you to engage the right muscles to make the movement, and once you did it repeatedly in the office and at home, then it was it became you.
Yeah.
So how much of what we did here did you repeat? How much time did you spend? Was it on a daily basis at home that you repeated these very simple exercises?
It wasn't daily, to
Okay.
be honest.
And
Maybe,
you know what?
but even when I did it, it was just have a yoga mat, most
and
of
on
the
the
ones
floor.
on the floor. I mean, I think the important thing is you didn't give a time limit. You just said, just stop when you're uncomfortable. So I think it really depends. Sometimes I would go like 2-3 minutes, couple of movements.
Exactly.
And sometimes you make me stand against the wall and you just say, try this, like make sure you're
not try to mark the wall. And that's the thing about frozen shoulder, because it's easy to walk your fingers up the wall using your body, contorting your body versus doing it effectively.
So it wasn't much, to answer your question.
And I think that's important, and the reason it didn't have to be much is because you're not doing anything your body doesn't already know. Like I've used the metaphor of your telephone. Your cell phone comes with certain apps you can't delete. So these are the apps that we are born with. So just trying to do them and using them is all it takes. There's no teaching involved. It's just reminding more than anything else.
Right.
I think I'm very, very happy with your progress. You certainly reached a point where thankfully my estimation of how the treatment was going to be was very close to what it ended up being.
Yes, absolutely. And the first 1 month was very hardcore, like the cleaning, intense, but it was pretty intense. But I realized that after the next day I would be very sore. But then I had more mobility, and so I would want to come back. And then so every treatment I could see that I could move my arm even more.
Exactly. So we had a functional, had a functional improvement. And the soreness we're referring to is like someone who's not used to running, and then the next day is like, wow, I had no idea I had those muscles there.
Yeah.
So it's not like I beat you up, or did I?
No.
Anyway, thank you so much for sharing your experience in the office. It's always fun to see you. It's always good.
Yeah, I can. Yeah, I feel happy that I can move all the way.
And I have to tell you, it's always wonderful to see you. It's wonderful.
Thank you, doctor.
Thank you. Thanks for watching, and make sure you subscribe to the YouTube channel. Check out the website, and hey, I have a podcast. You should check it out. Thanks for watching, and don't hesitate to send me your questions, your comments. Take care.